Okay, another one to go. Year 11 keeping these ticking over just for the exam on Wednesday for your medicine. Just having a look at the overview question for theme 3 cures, which is one that I don't think has previously come up. Remember, I've done all of the themes. I'm just repeating some of these ones just to try and keep content sort of like up to date and relevant. Now, if theme 3 comes up, medieval, it's really straightforward. To be honest, you're going to write the same answer for theme 3, treatment and cure, as you probably would do for prevention, as you probably would do for knowledge. There's not a massive amount of difference. So there's loads of different things you can put in, but non-negotiable if you remember these going into the exam. So medieval, treatments and cures are based on the 4 humours by and large. They're based on the ideas of Galen and Hippocrates. So the idea of the 4 humours are out of balance, so you need to treat whichever is out of balance. There were other cures that are based around alchemy, around superstition, we know flagellation, prayer, etc. People just expected that those sorts of things would treat and cure them because of a lack of knowledge. Now the main idea, I suppose, the main treatment that was devised from the 4 humours is bleeding. And that was used through barber surgeons or through leeches, various different methods like that. Plants and obviously things like that were also used, but generally that is a decent paragraph for theme 3, medieval. Now, we're going to the early modern. Again, we get the same thing, probably saying every single theme, no matter which one it is the approach becomes more scientific. That's not to say that it's worlds apart from the medieval period, but it does become more scientific. You've got things like the printing press, where you can spread treatments and ideas around. You've got the microscope, so you can see more. And you've got some developments in anatomy, which could also be mentioned as well, it helped along with treatments and cures. Now, I put barber surgeons in there, were still used, that's a negative. It's also positive because lots of Paré introduced a treatment which used egg white, turpentine and rose oil to treat gunshot wounds on the battlefield instead of cauterizing them. This improved, obviously, the treatments and cures beyond where they were in the previous periods. Obviously, Vesalius as well would have improved treatments and cures because the understanding of anatomy would have improved from the time of Galen. But again, you've got to make that relevant to treatment and cure rather than just knowledge. Also, obviously, treatments and cures are based on weird wonder drugs like rhubarb and tobacco, which made no sense at all. So, while you've got some development to move forward, you've also got some negative old ideas. Now, if we move into the modern period, I should probably mention Simpson and Lister first of all. Now, the reason that they come under treatment and cure is because we're talking about surgery. Really, you've only got 2 major treatments and cures, haven't you, broadly speaking? You've got surgery and you've got drugs. Now, Simpson and Lister are responsible for anaesthetic and antiseptic. Simpson comes up with the first anaesthetic, which is chloroform, which is used to put people to sleep. Obviously, they don't die of shock during surgery. Lister comes up with antiseptic, which is carbolic acid, which is what we used at the time, which cuts the death rate in surgery down by about 50%. Okay, so that's a major one in the industrial period. Now, I've also put Marie Curie in there. Now, she's relevant for treatment and cure in a number of ways. X-ray, obviously, improves treatments because you can actually see what you're working on. Also, radium and polonium pave the way for treatments that are directed towards cancers. And then most recently we've got Christian Barnard, who's developed the first heart transplant and obviously led the way to various different keyhole surgeries, etc, etc. And the one other one that's not in there that really should be is Fleming, Florian Chain and the development of drugs such as penicillin, antibiotics, which saved millions of lives in World War II. You could also talk about magic bullets, the first one salvaged in 606 to treat syphilis. Okay, so treatment and cure comes up, this one should sort you out.